Deputy Richard Boyd Barrett.
Yeah.
7 minutes.
Well, I think the urgency of this debate and the importance of this debate and the deliberations of the committee and more importantly, coming out with a real strategy and plan to deliver a health service that works for all of our citizens is couldn't be more critical. You know, you have to put a human face on these things, and I know everybody has cases and people they're having to deal with, but you know, to me, the case of a young man called Mark O'Brien, and for that matter his father, William O'Brien, who I've put in several parliamentary questions about. Indeed, I think he was on the national radio recently, describing his situation. A young man who has a very, very rare disease, and as a result has strokes constantly and is very severely debilitated by this condition, looking for, and it's acknowledged that he has a need for home care hours, and when we send in the parliamentary question to the Minister, the reply comes back that the budget for home care hours is at capacity. Right? That's it. There's a need, a desperate need. Mark's father, who also has a very bad heart condition, much older, and his wife have to travel consequently on a train, and their health isn't up to this, from Shankill to Dunleary to look after their son. And as Melissa in my office said, when William the father, who's going to see his son Mark, because he doesn't have the home care, comes into our office pleading with us to try and get these home care hours, he's completely out of breath because he has a bad heart and lung condition himself, and indeed probably needs somebody to be looking after him rather than have to go and look after his son. But the budget is at capacity, and that's it. They're actively seeking money. This is just not acceptable. And you see, you know, often when I hear these debates and I hear all the different sort of categories of issues around the health service, you know, your head can get fried, and you can sort of be drawn into thinking, well, I'm not an expert, I don't really know, it's all very complicated, how do we solve this, it's going to take a long time, there's so many different things to balance. And what is absolutely fantastic about what Alison Pollock said is no. You have to start from basic principles. If you have the basic principle right, everything else will begin to fall into place. And it starts here. That's what she said. It starts here in this Parliament, passing legislation to the effect that we are going to set up a national health service, and that health services will be delivered on a universal basis, on the basis of need. Not on the basis of budgets, money, trying to balance private interests against the public system, and so on. And indeed, you know, it sort of echoed what Alison Pollock said yesterday, I've been lucky enough in doing my sort of interventions on the health debate over the last 5 years to have a doctor sort of giving me advice who happens to be a member of our party. And I would always be looking for the sort of complex stuff from him and saying, but isn't it really much more complicated? And he said, no, it's really simple. It's really simple. We just need a national health system. There has to be a commitment for that. And that it should be free at the point of need and delivered on the basis of need. And if you have that principle established, and if that is legislated for, everything else will follow. And in fact, in the long term, it will save money, or certainly will not cost more. There may be more upfront costs to get this established, but it actually works out cheaper. And Alison Pollock underlined this. A very eminent person underlined all these points we've been making for the last 5 or 6 years in her comments. And she explained it in simple and clear terms, following on from the quote that Deputy Barry said, where she said, no country in the world that has delivered universal health care through a market or for-profit provision or private insurance. No country in the world is capable of delivering it. And yet we still cling on to that system. And she goes on to explain why. Because markets operate through selection and exclusion, transferring risks and costs back to the users of service and denying care to those that need them most. Risk, selection and exclusion is built into the design of a market administration. She goes on to cite the US system as the sort of worst example of this, where health expenditure is 18% of GDP, much more than countries that have a national health service model, like Britain and so on, where it denies, they spend much more than anybody else, but it denies 1 in 5 of its population access to health care. Over-treatment and denying, quoting her, over-treatment and denial of care, health care fraud, catastrophic costs and spiralling health expenditure are the hallmark of US health care. More marketisation, higher administration costs, the greatest inequalities in access and health outcomes, lack of coverage and the highest out-of-pocket payments. And these all could be comments about our two-tier system. €3 billion in out-of-pocket payments because of user charges in A&E, prescription charges and so on and so forth. €2 billion of Irish health expenditure, which is one of the highest, going to the private health insurance companies. All the unnecessary billing, all the admin, all the advertising, all the profit-taking. All waste. Money that should be going into the national health system. So if we adopt the principle, and if we legislate for it, actually all of those resources can be diverted into delivering the public health system that we need. And I'll just conclude, by 2 brief points. One, I agree with the emphasis on primary care, integrated care and so on. But let's not allow that to be a reason for saying we need somehow we don't need more resources in our hospitals. The reality is our acute hospital beds per population are way below the European averages. So building up primary care should not come at the expense of putting the investment, staff, beds and resources into the hospitals. And lastly, on the wider question of capacity and so on, in the two-tier system, if it was made a single-tier system. And I've made this point before. All over Dublin and all over Ireland there are private healthcare facilities that stand empty or unused while you have people on long waiting lists or waiting on trolleys in public hospitals. If we nationalised those things, brought them into a single-tier, publicly controlled, universal system, we would have the capacity, the beds, the staff, the resources to deliver the sort of health service that the people need and want.
Thank you, Deputy.